Hey, this is Dr. Brian Robbins and Dr. Isaac Hill, Core Medics. We're here again today to talk about some pretty cool cases that we've been having. And so, Dr. Hill was sharing with me that he had a patient this week. Just had a pretty cool story. So we're going to jump right in and ask a few questions about that, if you don't mind, Doc. So tell us a little bit about this patient that you were telling me about.
Sure. This patient has been coming to chiropractic treatment for about 3 years, coming to see myself, and we were kind of in a transition time, and she was just kind of, she just kind of expressed to me that she was dealing with an issue that can kind of be a little embarrassing. But she said, "I just really want to tell you, doc, that I've been coming to you for about 3 years, and I just feel like I gotta tell you why I've seen the power of it." And she was saying that she's been, dealing with issues with bowel movements. And she said, well, it's not the constipation, it's the opposite. And she said, the very first time I came to see you, she said, that day, she said, I completely was normal. And she said that I thought that was kind of interesting. That was kind of, oh, that's just in my head. I can't be a correlation.
Right.
But she said, now I've just been coming to see you every 3 to 4 weeks, because she says if I don't, I'm not regular. And so, very cool testimony. She's been coming to see me for, that would be 12 visits a year, just once, almost just kind of like a maintenance kind of a schedule.
Yeah.
But can you tell us a little bit about how that correlate? What's
Yeah.
going on with what's going on neurologically there?
So neurologically, we know that the spine, the bottom five levels of the spine, those nerves come right out of the spine. They go right out to different organ systems, muscles, ligaments, tendons. And we know that in the lumbar spine, that several of those nerves go to the intestines. And they go to the large intestine, they go to the small intestine. And so we know that if there's misalignment in the spine, if there's compression on those nerves, then they're not going to be able to transmit the signal from your brain down to those end organs. And so, in my career, I've been practicing for 30 years, and I've seen a few patients that have done the exact same thing, that either they were constipated or they had diarrhea the other way. My own sister, when I was a child, my parents would take us to the chiropractor because she would have problems with the exact same thing. And so it's not one of the most common things we see, but I've seen a few of those as well. So you're saying that she noticed almost like first visit, second visit?
Yeah, that's what she told me, and I'm like, well, why are you waiting to tell me just now? And she said, I don't know, I just kind of felt like I decided to tell you. So I thought that was a really cool thing to share. And when you're dealing with an impingement, when the nerve is not communicating up to the brain that sits up here and it travels down that spine, it can cause a lot of issues. So if it's a muscle issue, it can cause spastic muscle, it can cause things to kind of jump and contract, or it can cause it to be weak, fatigued. So the same thing can happen with the visceral. So in her case, she's got smooth muscle in the intestines that are contracting, that are pushing through the fecal matter, so that we get to the area of elimination. So if the nerve is impressed, or it's losing that communication from body to brain, and it's not contracting, or it's spazzing, it's going to cause diarrhea. If it's not contracting at all, it's going to cause constipation. So we see this also in patients with like heartburn issues. So when you're dealing with food that comes down the esophagus and that valve opens up, the cardiac sphincter valve opens up, and it's not communicating well to shut well, you'll have a quivering little valve. So in that thoracic spine is kind of what controls that. We adjust that area, and now it shuts and it communicates that gateway to compress. So we help a lot of people with heartburn issues also. So,
Doc, I've noticed from your practice as we've been working together that you have quite a few children that come in for treatment. And I was just curious, do you see the same types of things with, bedwetting, or with, controlling bowel or bladder with children as well?
yeah, absolutely. And more commonly, we work with is children that are dealing with ear infections. And ear infections, we have to understand that there's a tube in the ear that drains the fluid. So just like in a house, If there's standing water in a house, we get mold, right? And so, in the same manner, in the ear, if there's standing water in the ear, it'll cause irritation to the skin, which will cause an infection and cause irritation. And when you're young, that eustachian tube is like horizontal. So when we start to grow and we start to age, it starts to stretch and it starts to go more into a vertical canal. So what medicine does is they just take a tube and they just, on that horizontal canal, they just push a tube through there and opens up that area. But just like if you're in an airplane or going in the mountains and you get that pressure and you feel the ears kind of closing up on you, that's that eustachian tube that's getting pressure on the outside, pushing that tube to close. And so you feel that sensation that you got to open your jaw and you got to make that popping sound in your ear. So that's kind of what we do with children is we just do a very, very gentle stretch to that eustachian tube by taking the earlobe and then just doing it almost like a J channel opening. It releases the pressure surrounding that canal and it opens it up and it allows that drain to drain.
Awesome.
So just kind of like a toilet, if it gets a little bit too much pressure built up, that water won't drain. We just need a little plunge to help clear it up. So.
How about another thought, another type of patient that I know I see quite a bit of? Could you expand on, those very top 3 vertebrae affect nerves that go up to the brain and to the head? What do you do with headache patients, Doc?
Yeah, headache patients, we want to be looking at the brainstem. So the brainstem is where the brain is sitting above the spine. So if we're sitting up and through here, there's that cord that comes through here, and right into here is the brainstem. And that brainstem is kind of like the connection between brain and spinal cord, and there's a lot of transmission that's happening into that area. So we live in an era of a lot of phone use. So we're down text necking and we're computer working, and it puts a lot of pressure into that area of where that C1 area is, and it just puts a lot of pressure in those cranial nerve endings, and it'll just cause radiating pain to go up into the temples, the front of the heads, maybe pain in the back of the eye. And it's all starting from those muscles that are just tightening because the body says, hey, something isn't normal, something isn't right, so I'm going to give you some signs that you got to fix this problem.
So just a light little gentle adjustment to those areas will help them then control those headaches?
Yeah, we use a very gentle technique called an activator. An activator is very, very gentle, taps the body, it moves the bone about 3 millimeters, and we use that with children and maybe cases where the older population, we want to be they're more fragile, we want to be more gentle with them.
Awesome. Well, thank you again for tuning in. If you would like to schedule an appointment with our office, it's easy, CorMedix, and the number is 434-793-0700. Thanks for joining us.
See you next time.